My people, where una they watch this video. My name na Gertie Chimeka Anyanwoke. I am a doctor, an infectious disease specialist. Na for Bodo Ibu I dey practice. So we come this mission on behalf of the Association of Nigerian Physicians in the Americas to bring some succor to some of our people that are needing it in Edo State. So make una dey listen wetin we dey talk. Sometimes we fit talk for English and sometimes we fit talk for Pidgin so that make una open una ears, make una dey hear wetin we bring come as educational material for COVID. You see, a lot of people, they talk a lot of things about COVID, where we say a lot of those things when they talk no be true. If you want to know which one be true, make you listen to your doctor. Make you listen to the health offices and the people where they for government, when get the office, where people tell you, the authority to tell you the truth about COVID. No be everything where we see for internet, we go believe, no be everything we see for Facebook, for WhatsApp, for Instagram or Twitter or whatever that we go believe. Now, where we deal with this COVID thing, you see, COVID-19 now virus where just come out the end of 2019. Then first find out for Wuhan, China. And for that place where they call Wuhan, China, as it start there, the Chinese people they try to not tell people, but after they can't talk more, and tell the World Health Organization when they call who, say nah true, say the thing, they don't see them, and they don't know the virus. They say nah the virus, nah new virus. And since that time, they find how to attack this virus, because the virus fit kill people. Sometimes it will cause sickness, but the person no go die. In fact, majority of the times. So as you see this picture here, now the virus be this, now the Obonge virus where they cause the COVID-19 be this. Now the shape of the virus, now it make them they call on corona as it be say around so. Now the waiting that they call RNA where the virus they take propagate itself. Now the genetic material 9 days here so. They call them nucleoprotein. And for here, now the the membrane of the protein. And this here, now be the glycoprotein. That's the one they call the spike protein. Now this spike protein, the virus, they take attach itself. When it gets to the human cell, go attach itself, join our own tissue. Now there they take attack us. So waiting scientists then we don't do obonge studies. We don't find out, say, if they come do vaccine, we go prevent this spike protein when they here so from attacking our own body. See, the spike protein, when they put the vaccine, it go come create what they call antibody. When go attack this spike protein and the virus and prevent it from causing too much illness, we go feel make person can't die, or maybe person can't go for hospital, go stay, go take bed. Now the matter where we bring come be that today. This virus don't kill more than 900,000 people for America alone. For world, it don't pass millions. The virus, the thing where they say, they change, like many viruses they do. Now those changes where the virus they do, now they call them variants. Make I explain that one a little bit. You see, if you they work for factory, sometimes when the machine they make the product, if it make mistake, or make one way they say go there a little bit defective. Now so it be for the virus, because the virus now very simple and organism. Now, the first one where we know, the one where come from Wuhan, China. Now they call the first COVID where we be see. They call them wild type. After that one, now in the COVID carry himself, they waka the go the whole world though. It can't reach for United Kingdom. Oh. Now we can't get the one when they call they call them alpha variants. They can't get the one when they call beta variants. Don't go the whole world. You can't get the one when they call gamma variants. You reach the one when they call Delta variant. These Delta variants are from there. Now they call identify already, say another one don't come out. They be see them for plenty places. It be there for Europe, for many countries. It be also there for South Africa, some other countries. But now the South African people, now them be the people where first come talk about it because they get the kind of obonge machine where can detect the virus quickly. And that one they call Omicron. Now that Omicron self, you don't come be mama of Pikino, Omicron, I see the day around. You don't get many variants. And go call this one Omicron, this, Omicron, that. As you hear them, I say, still that COVID-19 virus, now in they change. So again, why we bring this matter come? If we all take the vaccine, it will help to prevent the virus from still being around and causing more problems. And then from one person to the other, the virus keeps changing. So if we can stop the virus by getting vaccinated, all of us, and wearing our mask, washing our hands, doing all those protocols when we done the talk from beginning, don't pass 2 years now, make we they do. Now it will help us drive this virus come out for our lives. This virus, like I was saying before, the one where they call Alpha, now for United Kingdom, we see more. The one where they call Beta, now for South Africa, we see that one. The one when they call Gamma, now for Brazil, we see more. Delta, it come for India. And the Omicron, like I said, came from multiple countries, including South Africa. There are some other ones when they call variants of interest. See, the ones I named before, now they call them variants of concern. And those ones, they're strong, so everybody begin fear them. Another level when they call variants of interest. They don't get a few, we don't come there. But so far, they never cause too many damages. The fear we say, we go come get the one when they call, the obonge one when they call variants of consequence. If we get that one, vaccine no go work, or medication no go work. Now we they try to prevent, make we no get that variant of consequence. Now make we they tell people say, make them they follow those protocols like masking, especially if you go for a place where plenty people there. And also, if you fit, make you take the vaccine. So this talk, where we want to talk now, I go, make we see, because we don't get some obonge doctors, pharmacists, nurses, where we don't assemble, where go come help us talk this matter.
Okay, my people, I salute you now. My name is Dr. Cliff Eke. I be member of Association of Nigerian Physicians in the Americas, ANPA. Now they come to Edo State to come do medical mission. And part of our medical mission, we have a COVID-19 team. I'm gonna be asking questions to our very intelligent panel of doctors, pharmacists, nurses that will help us today. First of all, I wanna ask Dr. Gertie, Chimeka, Anyanwoke, who's our chair of infectious disease and the COVID team. Good evening, Dr. Anyanwoke.
Good evening.
How are you there?
I do.
Okay, good. Now, this COVID-19 vaccine, where everybody talk, where I hear say they're important. When we take them, if they change our gene, our genetic makeup, now they hear somewhere like that for social media. Make you help us.
Now the thing where social media they cause be that. People will know what they talk, they will still talk. Everybody gets phone. If they record something, they go put on for internet. The answer to the question are no. The COVID-19 vaccine, they reach our DNA. Talk less of make it can go affect our genes, make it can change something there. No be true, my people. You see, when we get the injection, they go inside our muscle, but then they go enter our tissue and our cells. And then it go tell the body, say, make you produce something against this virus, so when they affect people, so that your body go come produce what they call antibody, where it go come fight the virus when the virus won't attack you. Now, getting the vaccine, it no mean say you no go fit get COVID though. You fit still get COVID, but because you don't take the vaccine, if it decrease the seriousness of the COVID, so that the person no go end up for hospital or even die. Okay. Especially people where they get multiple, many medical problems like hypertension, diabetes, asthma. The people where they smoke cigarettes, they get bronchitis, and this COVID feel no good for their body. Even the people where get body, small, like maybe the person fit there on the fat side. COVID don't show, say they know they do well, those kind of people. People when get cancer, people when get other medical problems, where they already worry their body, when COVID hits those kind of people, they're too good. Thank you.
Thank you very much. I learned something from that one. Okay, you talk, say people will get medical condition. The COVID, they like them well. They suffer them fast. So make I ask one of our smart nurses waiting for this forum, Chika, Duru, if you follow, clarify this thing for us. So if I get medical condition now, is they safe make I take this COVID-19 vaccine? Dr. Duru, I beg.
Yeah, Duru, my people, I throw a salute. So I don't work for this infection prevention, at the direct infection prevention for years now. I don't tell where they do this. So what now they tell you now something where it will benefit you. So the answer to this question, say if you get medical condition, say whether you supposed to take the vaccine, the answer now yes. Because when you're already there sick, we already have some medical condition, that it will put you in a position where you go even get sicker, pass somewhere where you don't get medical condition. So it's absolutely important, say you get that vaccination.
Okay.
And they try the pidgin English.
No, you do well. No, Dr. Duru, you do well.
No, that's excellent.
When I don't come out for Nigeria, waiting for America, and then they sound like this. I'm impressed though. While I still get you, I can ask you another question, I beg.
Okay.
So this COVID vaccine now, when I say it's safe, go change our DNA. And then if I get medical condition, it's even more important, make I take them. No be so. What if I take them? If it give me COVID-19 when I take the vaccine?
No, it will give you COVID virus because this vaccine no get live virus.
Okay.
So there's some vaccines where you get live virus. Then there's a little fear for those ones, but this one no be live virus. So it will prevent you from having COVID. And it not be say if you get the vaccine, say you go take all the necessary precautions. So you go still they take those precautions, you go still they cover your nose with mask. And not be say when they say make you use mask, you put on just for your mouth. You go cover your nose, cover your mouth. And you go make sure say you they wash your hands and make sure say every precautionary measure, you go there closer to people. When you there for crowd, you go there close, you go there 6 feet between people who are there for crowd. So it's very important, say you get that vaccine and then you do all the precautionary measures.
Okay, that's good to know. So no, I don't just cover my mouth. I have to cover my nose too.
Absolutely.
Okay, then I have to wash my hand or use sanitizers. And then keep some distance from people.
Absolutely.
And not stay too much for crowd. Okay, thank you, Dr. Duru. Make I ask somebody else who there for this forum. Dr. Pam Moye Dickerson, who is one of our pharmacists, and I want to ask her a question. This virus, these vaccines, COVID-19 vaccine, mRNA vaccine, which is the Pfizer and the Moderna, are there any side effects to it? You can speak regular English if you want, so we can mix it up with Pidgin English. Go ahead.
Sure. So serious problems from vaccination can happen, but they are very rare. The CDC has learned of reports that some people have experienced severe allergic reactions, also known as anaphylaxis, after getting the COVID-19 vaccine. As an example, an allergic reaction is considered severe when a person needs to be treated with epinephrine or EpiPen, or if they must go to the hospital. That's according to the CDC.
Okay. So there's no serious side, people can tolerate it more is what you're saying.
Yes.
Okay.
Yes, serious problems are very, very rare.
Very, very rare. Okay. So my people, you are still there? Question 24. This question I want to ask now for Dr. Nkiru Mbionwu. Can a COVID-19 vaccine make me sick with COVID-19?
Dr. Cliff, that's a very good question where you be asked. So the COVID-19 vaccine, no fit make you get sick with COVID because you know get the virus inside.
I see. Good. That's good to know. So they know they give us the virus.
No,
okay.
Not the virus.
Now,
not the virus.
Not the virus. Okay. Something else I want to ask you though. What if I get underlying condition? Say maybe I have kidney failure. Are they for dialysis, or I have cancer treatment before, or are they for chemotherapy? Is it safe for me to still get this vaccine?
That's another very good question where some people they ask. So if you get underlying condition we say if you get diabetes or high blood pressure, so it is safe for you to get the COVID vaccine as long as say you don't get allergic reaction to the vaccine before, or the ingredient we then make the vaccine. If you know they're allergic, then it is okay for you to get the vaccine, even say you get other health conditions.
Okay, thank you very much. We appreciate you. Make I ask somebody else, Dr. Teresa Pounds. Yes. Dr. Teresa Pounds is also our pharmacist, not only pharmacist. Now she be the leader of our pharmacy team. Even in America, all the pharmacy people with they smart, the organization, they call NAPPSA. Now she be the Oga Pata Pata. So I salute you.
Wow. Thank you. Thank you, my
Dr.
brother.
Pounds. So
yes,
question way people they ask now, if I get COVID-19 vaccine, if it protects me from getting sick from COVID-19 or not?
That's a good question, my brother. Some studies have shown, I make us speak for the Oyibo English here now.
If you speak Oyibo, if it mix themselves, no problem.
I feel mix them, yeah. So studies have shown that, in United States, first of all, make us speak straight English.
Okay, no problem.
No problem. So all COVID-19 vaccines currently available in the United States have been shown to be highly effective to prevent COVID-19. So based on what we know, for other diseases and early data from clinical trials, experts believe that getting COVID-19 vaccine may also help keep you from getting seriously ill. I think that's the key thing here. That once you are vaccinated, that can help you. It's not that you can't get it, you can, but it will help you from getting the serious symptoms. And like our doctor, the infectious disease doctor said, you won't get sick enough to get into the hospital. In fact, we also hear some story that some even people in Nigeria, within 2-3 days, they're up going about. So that's the key thing, that it prevents you from having the serious symptoms from being admitted, but it does not say that you cannot have it. Yeah, but precaution is still the key. Like infectious disease nurse said, make sure you mask in and everything. Yeah.
Okay. So basically, they tell us, say, if we get the vaccine, if they protect us, maybe we don't get sick, we will end up in a hospital.
That's
or we will die
correct.
from it.
That's correct.
We still fit get them, but it no go kill us. Not the thing, right?
We get them, but it no go kill us. That's
okay,
correct.
Amen. We thank God though for that vaccine. So I'm gonna ask myself some questions. Is that okay?
You are doing an excellent job.
Yeah, ask yourself.
Make I ask myself, but to make people think, say, I sabi something too.
Of course now.
And they wonder, say, how this vaccine they work. I mean, a lot of people out there, they wonder how this COVID vaccine they work, sir. So the COVID vaccine, when they give them for our body, the way I understand it, and we have infectious disease specialists here, both of them, and they can correct me. When I finish, they can correct me. But the way me understand them, they say, when we get this vaccine, it makes our body make some protein where they call antibodies. These antibodies now, when we get exposed to the COVID virus in the future, the antibodies bind to those spike proteins. And they say, it make our body, we make antibodies, then the antibody go protect us when we get exposed to the virus. And so the more of us we get this vaccine, the more our community gets protected, and then we don't get sick from it. So I beg, make una check me, infectious disease specialist, Dr. Duru and Dr. Anyanwoke, if what I say now correct. Una they hear me?
So correct, well.
You say I'm well now.
Yeah.
Okay.
Why would they encourage everybody say they can get the vaccine? If plenty of us can't get the vaccine, then we go get protected against the virus.
That's correct.
Okay, good. And this one where now for anybody of women, and Nigeria will have a lot of young people, and they want to get pregnant, and they want to have baby. So I believe somewhere for internet say, oh, if you make you not get pregnant. Anybody will sabi that, make you coagulate that one for us, I beg. Okay.
Yeah, for what we know is safe. The vaccine is safe for pregnant women. So and Dr. Duru, you can add to it, but at least from the clinical standpoint, for what we know, pregnant women can take the COVID vaccines, and and it's safe with no different adverse effects. Is there anything else you want to add to that? So
no, I mean, you're right. The only thing that I want to add to it is just to make sure that they talk to their doctor, because their doctor know their condition, so talk to their doctor before they proceed. But it will not cause infertility. They go feel born pikin.
Okay, good. Thank you for that. Even me, self, I read the paper we come out from Pfizer and all these vaccine makers, and some people wait there for get the vaccine. We're not supposed to get pregnant. They even get pregnant and they do well. So that tells me that cause problem.
Yeah.
Okay.
How about for children? How about for small children?
Now my question, and the next question they ask, Dr. Paz,
I just want
my mind now. If you like say they read mind though, that's good. How young can somebody get this vaccine? Where would they talk? To what age now? Anybody want to answer that one?
As at this time, they do studies to get younger children involved. But from now, children when they're like 5, 6, going up, 9, they take them. The one when they go do next, they don't do that study finish, but you get what will remain for the CDC and the rest of the people, the Ubongo people where they do the studies. Whenever they come out with it, before they go approve them, make them they give the younger children when they're like 5 years and below. But for now, all the children when they be from primary 1 to the oldest person, they can take the vaccine for now. They approved. You know, go to take and go do the one for the younger children.
So to add to the matter where we talked before, in the United States, children when they 5 years and above can take the COVID vaccine. Oh. But they never approved that one for Nigeria. Now still 18 years and upwards. Although recently, children when they 16 and 17 wey won't travel go obodo yibo, them they give them the vaccine. Oh. Thank you.
Okay, so they study for younger, but anybody with they 5 and above, they fit get this vaccine.
Yes.
Okay. All right. Now, Dr. Anyanwoke, since you spoke last, I want to pick your brain because I did for Nigeria in December. I go for Christmas, to go be with my people. And as I go, then they tell me I wear mask, and they look at me funny, small. They think say I bring COVID though. Even though I did vaccinated, I don't vaccine though. I don't vaccine, I don't boost myself. So then tell me now, Oyibo disease, it be. Say vaccine, COVID no day for Nigeria. This one not true?
No be true. No be true. Now, the truth of be say, the COVID-19, be saying that Nigeria start from. It starts from one place when they call Wuhan for China. But as it starts from there, now it can't go around the whole world. Waiting they happen for America and Europe and what we call Western world. They say it affects a lot of the population of people when they say now older people when be there for nursing home, for this side of the world, when people don't old like that, their family figure put them for some place they call nursing home. A lot of those people get medical problem, and the older we get, now so our body ability to fight disease they decrease. So now the disease come kill a lot of those older people and the people when get medical condition, because at that time we no waiting with the disease. The disease there everywhere. It there for Nigeria, it there for India, it there for everywhere you think for this world. Now it make them call them pandemic. The thing where they say when the disease first come out and people see how the thing they kill people for America or Europe or all these Western countries where get all these obonge machines for their country and for their hospital, and they no fit save their people. When they come look Nigeria, say, Nigeria no get all this kind better
fancy,
machine and
fancy stuff.
Fancy stuff, hospital, big hospital with all kinds of technology. Say how the people for Nigeria. So the Papa God where they our side, we say it no can happen like as a thinker. Say it go happen. But it not be say we don't get that for Nigeria. It just be say God save us in some way. Now there are still studies when they go on, make them find out why it not be as bad as it be for America and Europe.
Thank you. And say the world now small village now, because we they fly. Today we there for America, tomorrow we there for Lagos, or we there for Abuja, or there Nigeria, anywhere. So these things, they move the virus up and down too. So thank you for that answer. If a woman where they pregnant, where carry belly, or a woman where don't born pikin already, where they breastfeed them, if they say make them get this COVID-19 vaccine or not? Now
so that question, a good question it be. Because I know say pregnant woman, they worried about the vaccination. So yes, it's important that they get the vaccination, because when they get the vaccination, the baby where that woman will carry, when he born them, the chances that the baby will get protective antibodies there, So yes, the answer is yes, they should get the vaccination. Actually, both of them, they should have that. They should get vaccinated. I think one of the they need to really talk to their primary care to their doctor too. Just because their doctor have better information about their health issues and all that. But I think the answer is yes.
Okay, thank you very much.
Let me add more for that.
Add something, Dr. Anyanwoke.
So before, when they first do the vaccine, they never they sure say they're supposed to give out to pregnant women or women when they breastfeed. But they come see say for the study where they do. Part of the people where they for the study now young women when they eat born picking. At the time they start the study, they never get belly. Now inside the study, now they can't get belly when they give them the vaccine. And they come watch, say they come born the children they okay. And the children, they even get the antibody when go help them fight this virus if they get them for that early age. So they can't be study this thing, they can't do more studies. Now they can't get overwhelming evidence. Say, oh, this vaccine, no, it better say me they give them to pregnant women, because when pregnant women get the COVID, it can kill them. In fact, they worse when a woman they pregnant can't get COVID. So now make them come, they say, make we begin give pregnant women COVID vaccine. And also women, when they breastfeed, make we they give them COVID vaccine, because even if they suck the breast, they go fit get the COVID antibody from there to protect them, like all the other vaccination where their mama don't take before, where they protect the little children. Thank you.
Thank you. Thank you for that clarification. Well, let me ask one of our pharmacists. You know, here we work as a team. The doctors, the pharmacists, the nurses, everybody working together to take care of you. So, Dr. Emilia Orubele, I want to ask her a question. Since this COVID-19 vaccine, we know is good, it prevents the infection or for us from getting so sick, so we don't end up in the hospital or we don't die. But are there any side effects that we can get when we get this vaccine?
Well, side effects vary from person to person. Some people feel absolutely no side effects. Some people feel like they actually have COVID. Some people have sore arms. And some people, if they're allergic to it, may have the more of the severe side effects, like the shortness of breath and what have you. So if you feel anything that really doesn't feel right, you go see your doctor. I'm sorry, I can't speak Pidgin. I can barely understand it. Hopefully you can understand me.
Yes, yes. We can understand your English
so
very well.
The side effects vary from person to person, and it varies from days to days. Some people feel just something just the one day. Some people the whole 2-3 days. You just take some Panadol or some pain reliever, just wait it out and it will go away.
Okay. So most people, you're saying, would then have very mild symptoms. For me, I got the vaccine. My arm was sore for a few days.
Yes.
And I felt a little achy, you know, maybe a little chill inside, but I took some Tylenol. It's like paracetamol, not too much. And by the second day or so, I started feeling better. But, you know, most people will not have severe reaction. Is that, we all agree, our infectious disease specialist, Naso?
Yeah, Naso. Naso.
I got that one. Naso, I can say so.
Let me add, though,
I wanted to add something to the side effects.
Okay, go ahead, Dr. Duru. That's what they ask now.
So the only thing where I want to add to the side effect is say, as Emily rightfully said, everybody did different. When I get the vaccine, I can't get lump where it come big like egg. You can not say this thing where they put for our body, it not be part of our body will react.
Yes.
So as our body they react, they say, what thing come from my body like this? It come from that kind of big that reaction. It can't get big blood for my arm. So you can have something like that. And if you do not panic. It's going to dissolve with time. It's just your lymph. Well, you can, Dr. Gertie, if you want to add to that, you can add to it. It's just a reaction that our body will react for something that is foreign.
Dr. Duru, you got better. Is that what you're telling us?
Oh, absolutely. I got better.
Okay.
It dissolved itself. Yeah,
and you're
absolutely.
still here?
Yeah.
Absolutely.
Okay, good.
So
can I ask a question of the pharmacist?
Yeah, Dr. Duru, wait, we're gonna talk some medication soon. So we're saying this side effect, don't get alarmed. Somebody told me that you may even grow another ear and things like that. Dr. Anyanwoke, can we clarify that, Self?
Absolutely not. Absolutely not. Yeah, this is a normal reaction every time you get a vaccination, whether it is COVID or even flu. I've had such reaction before when I had flu. vaccination. So, it tells me that my body is doing what it's supposed to do.
Actually recognizing the material that came in, and then it's going to make antibodies to fight it next time.
Yeah.
Correct.
So the bottom line is, if you have any sort of reaction, do not panic. You're
Absolutely.
not dying. We didn't give you the vaccine did not do anything bad to you. It's just a reaction, and it will go away. Don't ask, oh my God, what have they given me? I'm not feeling well. It's just part of the process. Okay, so no, be alarmed.
Thank you.
Just one small thing. The vaccine, like we've all said, it did good. The side effects are very mild. You get one small, minute population where fit get serious side effects. Which be say right after you take them, you fit begin get shortness of breath where you know fit breathe. That kind of thing. That one is serious. At that time, you're supposed to call your doctor, or if it's supposed to go hospital. If you get epinephrine, you should choke yourself epinephrine right there, and that will help you.
Good. Thank you for clarifying that. And also, that's why sometimes when I get my shot, they tell me, make I sit down for about 15, 20 minutes, make them watch me. Make sure they can't quit before I go come out. Maybe, okay. Thank you.
Yeah.
Can I add something, not to the side effects, but just, I feel like they need to know the signs and symptoms of COVID. So even if they don't get vaccination, maybe a week later, they decide, okay, I'm going to walk around. I won't put on my mask. I won't take all the necessary precaution. And then they start having fever, start having shortness of breath, chest pain, body ache, diarrhea. They need to still check that out. The fact say you don't get vaccine, no means say you're not going to cover your nose. You're not going to wash your hand. You're not going to do all the precautionary measures. Stay away from people where they're sick. So all of that, you still need to maintain that precautionary measure.
Thank you. Okay, I want to ask some.
What if they not get Tylenol or paracetamol and they get ibuprofen for their house? Then if they take ibuprofen.
They can take ibuprofen, yes.
Okay. Initially, there was some controversy about that, but I guess no more. Is that right?
That's why I asked that.
Yeah, that's a good question. Okay. Now, speaking since you're talking about medicine,
there's still controversy about that.
Yeah, about medicine, Dr. Pound. Since you bring up medicine, so I'm going to ask you medicine.
I don't ask the question.
No, I'm going to ask you, since now you bring medicine issue, we come here now. So I'm going to ask you medicine question. As you say, you be the for pharmacy.
That's right, my boss.
So I'm going to ask you a question.
That's
now
my boss.
Okay, but ask me.
Yeah, we know that vaccine is the way to go because prevention is better than cure. Okay. However, though, when somebody gets sick, he no take the vaccine yet. You get any medicine out there where they fit give them to treat them, where we fit hear about. I know, even in America or in Nigeria, you get some things medicine where we fit give, and then some remedies that we fit use.
For America, then get some medicine if you there for hospital. Where they go give, then they call that medicine remdesivir.
Okay.
Right. That is if you're sick enough that you're in the hospital. And studies have shown those that worked well. If they started doing it for 5 days, they get different doses. They can also add steroids, prednisone. Those have worked, but that is in the hospital. Now, there are some more new medications that are coming out if you're not there hospital. That one is still kind of restricted. Not many pharmacists have it. In fact, that's in the hospital. In fact, there's also another one that came out for those patients that cannot take the vaccine. And so the answer to the question, so they get certain medication if you're there for hospital, You know, like I said, remdesivir is the one that has the most history with your prednisone, I mean, with the steroid.
Right.
And in the outpatient, Paxlovid is something that is common. And then they also have the immunoglobulins. I mean, not the,
monoclonal antibodies?
Yeah, monoclonal antibodies. And that one, they've seen that that one has not been that effective. So they're not even using that as much anymore. So the one that still has maintained the popularity in the hospital is remdesivir. So we will see what the medication will be for outpatient, you know, going forward. So,
okay. So there's some research where they go on to bring new medication.
Yes.
Okay.
Yes.
But I want to ask our infectious, our chair of COVID team. I'm going to ask her a tough question now.
Okay.
Dr. Gertie, Chimeka, Anyanwoke. Because our former president for America, his name is Donald Trump. Him swear, say, ivermectin and hydroxychloroquine, that's all you need to treat COVID. I beg, make you help us understand this one, though. Dr. Anyanwoke, I feel just take my hydroxychloroquine, what I take for malaria, and ivermectin, what they take for worm and things like that. So no COVID.
Thank you for the question. You go the first say make people know waiting then they talk. Make them like anybody when they for one particular area, we know the thing when we're supposed to talk about the matter. As it be so, when we go medical school, I be go medical school for Nigeria, go University of Lagos, up school for Idi Araba.
Hey.
We be read down for book, say something like hydrochloroquine, it gets effects against virus like coronavirus. If you read down for book, they say it fits.
Maybe.
Because of the mechanism where they take act, the way where the medicine they take act. So say something fits, no be say
they do it.
They do it. Yeah. Like I fit come say, see as I did so I fit get aeroplane. No. You know be say I get aeroplane. See how?
I see.
So now waiting be the thing where they be say textbook be say if it may be. Now say when the Obonge virus come, now I follow for the people where give hydroxychloroquine for hospital. When the COVID first come, we not be get anything to treat them.
That's right.
Now we say make we try the thing now. You know work.
Okay.
Me, even before the people where go do Obonge studies come, I don't see say no work for my own patients.
So you stop them.
I stop them.
You stop.
I stop them. Now since 2020, now I stop them. Because at that time we no be get anything. But multiple studies, many studies since then don't show say it no help. Even the ivermectin when they talk, then don't do Obonge studies, join that one, no. It no show say it do anything.
Thank you. Thank you very much for that question. Please, anybody else has comments or advice?
Me get question when me go
Josephine, Okunseri, I salute you.
Yes, Dr. Eke, I salute everybody. Me get question. That matter where doctor talk just now. But me here say, me don't even see people where they talk say that medicine can't work for. How you can't get somewhere you work for, somewhere you no can't work for? How manage now? You know, because me hear that kind of story. It just there everywhere. Me know as I don't know as I do this on the internet, but me don't see and me don't hear plenty.
Okay.
The way you work for.
Now, good question with that.
So how can be like that?
No, that's a good question.
Very, very good question. Me, I like that your question when you ask. So you see, say as this COVID is, a lot of people when COVID don't affect, no even know say COVID don't affect them. I get a lot of my patients when they say I go to check them for other things. When I check, they say they get COVID before. They don't even know say they don't get COVID before. It be from all the studies when they don't do. When COVID affects the people when COVID they affect, between the people when not get any symptoms and the people when it say, my head they ache me small, or my body they hot small, they feel reach like 81% too. Now the people where they get serious, moderate to serious symptoms, if it be like 19%. Out of those, fit admit majority of those ones, if you end up for hospital, but maybe about 5% of them if you end up for the ICU. I say all these things, say, make I forget explain, say, most people when get COVID, they no need medication. Most people when get COVID, no need medication. So if I dey take ivermectin or hydrochloroquine, or chloroquine, and then the COVID no come hit me like that, I can't say, that's ivermectin where I take, or that chloroquine where I take, now ain't can't help me. No be true. Then don't do studies to show, say, if you be somebody where you say the COVID for no bring down, if for no still bring you down. Me, as for, I don't see people where they say, then they take the ivermectin and the chloroquine, now they still can't get the COVID, can't carry them to hospital, and they come put them for ventilator or machine, make machine, they help them to breathe. So, it no be correct, make them assume so. You see, now what is they call placebo effect? What is the placebo? Placebo, and I say, as so people they do one get studies, then go make and say, they will give one person something where they say no will kill them, but not be the medicine. They can't give the other people the real medicine. A lot of times they don't go tell you which one they give you. The people when they give the placebo will come, they tell the talk, say yes, I get side effects. I get nausea when you give me that thing. But waiting they give them, nothing there inside though. Now waiting that they call placebo effect. If you think it's like, I get that medicine, I do fine. You do me this, you do that. In fact, when I take the vaccine self, I be they get knee pain. Now I can't reach house. My knee pain don't come go. My children can't say, 9% of the vaccine, I don't take the knee pain, go away.
Yeah.
No, the vaccine not do reach like that. And so,
Doctor, you can't talk for inside something where they talk just now, say the people where get the COVID, some of them no need to, they know they need to go hospital. Hey, if they don't need to go hospital, why I go take the medicine again now? So if I get the COVID, they don't need to go hospital because you just talk and when they talk now, say some people will get plenty will get. No need to go hospital. They can't take the chloroquine now. They can't say I make them better, but you thought say they don't need to go hospital. So that means say the thing not serious that they thought say they're serious, Abi? Because you talk and say they don't need to go hospital, some of them. So I will just wait. If me get them, maybe I don't need to go hospital too now. I can just check them out. Abi no be so because they even thought say the vaccine safe. Say the thing be as it gets. So now just say make I just take chance because you now doctor come talk and say plenty no need to go hospital. So I feel just take chance now.
No, like we know if you take our life, take chance so because life won't get duplicate.
Not true,
we need to take chance. Say, life no get duplicate. If I take my life, take chance. Now I can't get the COVID, can't end up for hospital, can't end up for ICU.
God forbid.
That's what people say, may God forbid.
That's not my portion.
Because say, God forbid. Not be my portion with that. And God no go agree. Make we protect ourselves. Now be the vaccine.
Yeah.
The vaccine, now say we protect ourselves. It will increase the number of people where we say if they get COVID, you know, go do them anything. Now be the essence of the vaccine. Make we for no go take our life. Go play kalu.
Okay.
Make I add something small for that one. Where Dr. Gertie don't talk.
Go ahead.
So if you say you don't get signs and symptoms, and say you don't need to go hospital, if you get some family member where you go for your house, where you get sickness, where that's one way you get that small this way. If you pass them for that your family member, where you go if you can't get sick,
I say I reject that one. No, I just talk.
So now we say they do say you get vaccinated so that you no carry and come pass them for your grandmama or for your somebody where they for house. That maybe you get some illness, you get heart disease, you get diabetes, and they get other complications that could potentially get them to the hospital. So it's very important that everyone get vaccinated.
Yes.
Thank you.
I just want to add and just hopefully to put everything together. We have a COVID lab. We were one of the CDC labs that were testing everybody. those that were vaccinated exhibited different symptoms from those that were unvaccinated. So the takeaway is this: even if you're vaccinated and you catch COVID, you will exhibit some symptoms, but your symptoms will be very mild, but you can pass it on to the family members, as my colleague says here. Now, across the board, when we did hundreds and hundreds and thousands of people, most of the people that were vaccinated, and this is something for you to keep in mind, just because you're vaccinated does not mean you cannot catch it. It's just that you're mild, but you can pass it on to somebody else. Some of the symptoms are this: for those that are vaccinated: sore throat, runny nose. 10 out of, let's say 10 people came in and they were vaccinated and they were positive. 8 people, the common symptoms were sore throat and runny nose. So just be aware of those certain symptoms for those that were vaccinated. So so you can keep everybody safe and stay away, and just quarantine yourself. So those who weren't vaccinated or are vaccinated, you didn't give it to them.
Josephine.
I'm happy that, yes. I'm happy that she
Mhm.
mentioned the fact, because there is this erroneous belief that if you get vaccinated, you don't catch COVID. So I'm happy that you mentioned that while you were talking a minute ago, because that is the belief that people have. And then when they come with symptoms, it becomes a problem. Say, but isn't that why I took the vaccine? Why am I sick? So I try to tell people that you're vaccinated doesn't mean you don't catch COVID. As a matter of fact, you're a asymptomatic spreader if you get COVID, if you catch COVID. But the beauty is that your chances of severity or death is very, very low. So, and that is another thing a lot of people have to, get educated about. That it doesn't mean you won't catch COVID, but you get to survive it, at least 90% to 99% of the time. Okay.
Very good point. I like this discussion we're having now. This is very, very interesting. And I tell people say, oh, I can get COVID and I'm fine. My patients, I tell them, yes, you're fine. But your next door, your grandma may not be fine. Your next door neighbor may not be fine. Mm-hmm. So to me, to get the vaccine is a patriotic act.
Yep.
It's not just for you. We're doing it as a community. And that's the only way we can defeat this problem. So I thank you well for this robust discussion. But I have 1 or 2 questions before we finish. One, especially in Niger, now that we understand the vaccine helps, I want say a day for Niger now. I be Niger and I want to take them. Where can I go to take the vaccine? And is it free or do I have to pay out of pocket? Please, Mekona, help me answer this one.
It is free.
In Nigeria, or at the talk, no be for America, they talk.
Nigeria.
In Nigeria, it is free.
Okay.
And then you can go to your local health centers. I think Dr. Pounce, I'm not sure. I know they were trying to get the pharmacies. The NCDC were trying to get the pharmacies to also administer them.
Oh yeah, now it's now, in fact, we've given another training in July. Pharmacists now can start vaccinating in Nigeria. Before they were not. I believe we will find out when we go on this trip, but I think it's going to be free from what
but it is free for that I know for a fact.
Yeah.
What I tell our fellow Nigerians is, do not be a silent killer. You don't know who you have infected that you have killed. People who are not vaccinated passing these things around are what we call silent killers.
Wow.
Yes.
Interesting. Yes. That's a good way to put it.
Yes.
But I hear that the vaccine is free, by the way. The Edo State government, we're coming to Edo State. So the Edo State government have told us they have vaccines. Okay. And part of our team's effort is not just education. We're going to be doing some testing and also giving the vaccine all for free. It won't cost you a kobo. Now him where Sabi. No be so.
Nah, so.
I've learned one today. Now so.
My people. Una don't hear all the things when we don't they talk since about this COVID-19 matter. Make we know be silent killer. Oh, make we get vaccinated. Because even be say we strong where we're kakaraka like Zuma rock. The person when we get for house like our grandmama, fit no strong kakaraka, and we fit end up causing their death. No be silent killer, make you take the COVID vaccine. My name na Dr. Gertie Chimeka Anyanwoke.
When I don't hear waiting a doctor, we come from America, so we need to help each other. The main thing, the main message here is that we need to get vaccinated. The thing they're free is free, the testing is free. So make una take advantage of do it. Protect yourself and protect the people we una love. Get vaccinated. My name is Teresa Pounds, and it say Pounds, but I've been Nigeria too. You don't hear from which I talk to now.
Please, everyone, save a life. Don't take a life. Get vaccinated. Don't be a silent killer.
So my people, when I don't hear what we talk. Yes, we come from America, but we care so much about our country. We care so much about our community. We care so much about our grandparents, our children. So we want to say when we come visit, we go feel safe as we come to visit. So please, you don't sabi say the COVID na real. It's not fake. It's still present. So please get vaccinated.
Prevention is key. I'm not Nigerian, but I do consider Nigeria my second home. So I care about the population there. I care about my people. So please get vaccinated.
Awesome.
My people, I don't hear them from all of us. So make una go get vaccinated. If you no get vaccine, if it end for hospital where I dey work, I don't want make that happen sooner. So make una go get vaccinated, I beg. My name na Nkiru, Mbionwu.
My people, una don't hear for the obodo Nigerian doctors where they come them. Say this thing they important too. Make them not be saying as you. Now I come whether you know, say you know, no come be the one we can't keep people. And you know as this kind of thing they happen. Now the people where you know things say you go can't go kill. Now you go kill. You know go be. You know as this matter be. I beg, go take your vaccine. This one where you say this one no they happen for where we did. So now lie. Go take your vaccine. Say you never get it in now because plenty of us don't take. I beg go take your make you for join those way save life. Make you no be silent killer. We go soon as soon. Thank you. My name now Josephine Okunseri. Me join them. They come. Make me for love all of una when we reach there.
Our people, Niger folks, you know Nigeria they carry last. This COVID thing, not real, is real. So we have to take care of ourselves. And thank God say we don't get vaccine against this virus. Before when we don't get them now, they scared so much. So now, all these doctors from America, Association of Nigerian Physicians in America, and the pharmacists and the nurses, we come get together, get this message for them. Say, please, make una take the vaccine. The vaccine go save life. Not just your own, but your neighbors. And you sabi say the vaccine na free, so it no go cost you anything. Prevention is better than cure. Una sabi that one. So I beg, take them and no become silent killer. We love una. We dey come see una very soon. My name na Dr. Cliff Eke. Oshekoko.
That was good.
All right, guys.
Thank you.
Okay.
Thank you all for the opportunity.